As we come to the end of what has been an eventful summer, it's worth drawing attention to the activities in our hospitality and tourism sectors. We welcomed a lot of visitors into the Bay over the summer. And I think it's important to note that there have been very few outbreaks that we have recorded. Very few of our establishments or venues have had any issues of COVID being transmitted between staff or to visitors. And that, I think, is a really positive message about how working together in the consistent way that we have with that sector can indeed keep staff and visitors safe. And I think it does well for the reputation of our hospitality and tourism sectors that we have been able to meet that challenge and meet it with some success. The other area to mention is the reopening of schools after the summer holidays, and to highlight the hard work that has gone into our testing program, to complement the teachers and staff who have really done sterling work to coordinate testing students before schools reopened. And also for parents and guardians and students themselves who have continued to cooperate with the testing program, and also to maintain the advice about how to reduce the transmission of infection within the school setting. During the summer, we had a spike in cases, particularly among the young, particularly among those groups that have not yet been fully vaccinated. And our case rates peaked well over 600 per 100,000 as a daily rate. That compares to the previous peak of 266 per 100,000 cases per day. It's important to note as well that since early July, our case rates have been consistently high. We have not gone below 300 per 100,000 for most of that period. And it means that those high background rates create a bit of a challenge for us as we go into the autumn and winter season. We know that autumn and winter are the periods where other infections tend to circulate. As people move indoors, people tend to congregate together more and more because of the inclement weather or the cold temperatures. So we know that the flu circulates. We know that other respiratory viruses and infections are common during those periods. And it's also the period when traditionally the NHS has been under greatest pressure. It's interesting, therefore, that the NHS has generally been seeing the kinds of pressures that they would see in winter, even in summer. And therefore, the position we want to be in is that we reduce as much as possible the things that we have control over. With a vaccine program, COVID now becomes a vaccine preventable disease. It means that if we can work consistently together, as we have demonstrated we can do over the summer, if we can work together to ensure that vaccine coverage is as high as we can possibly make it, if we also have an equally successful flu jab campaign, we can reduce two of the greatest causes of pressure on the NHS in winter. And that is the aim of where we want to go to next. We are very positive that we're now seeing our case rates coming down, but we need to keep that momentum going. We want to get those rates down as low as we possibly can. to give us as much buffer. We're up against the Delta variant, which is the dominant variant in both the Bay and in England at this time. And that variant transmits more easily. It causes more severe disease and hospitalization in the unvaccinated. And so it doesn't give us very much room for error. We have to get things right if we are going to enter winter with our best chances of maintaining the NHS, continuing to deliver the kinds of services and getting us back to normal as quickly as possible. So our key messages are similar to the ones that we've said. Vaccination is one of the strongest and most powerful public health measures that we have now. It's important that as many people who are eligible are doubly vaccinated. And we want to make a push for those groups who have been offered a second dose and have not yet come forward to do that as quickly as possible. We certainly want to continue to encourage our young people, those who are 16 and 17. They have been coming forward very well for their vaccine as that has been offered. The booster program is in place, and you will be invited in if you're in that eligible cohort. And certainly the schools are ready to work with vaccinators to deliver the 12 to 15 jab to that age group. So vaccination programs are important, and we want to encourage people to engage with that as much as possible. We know that during winter, as the temperature falls, people move indoors. The risk of infection is greater if you're in enclosed, unventilated spaces. And so we're inviting people to begin to think about how you can ventilate your meeting places, particularly when you're meeting with people who are not of the same household. How do you ensure that there is air circulating that keeps the air fresh in that setting? Face coverings will continue to be important. As part of the enhanced response area that was declared over the summer because of the very high rates that I mentioned earlier, we have issued advice to our schools that face coverings will be advised in communal areas for students and staff in secondary school. That will continue for another period, probably at least until the end of the enhanced response area, which comes to an end at the end of September. But important across the population for any activity where we find ourselves in enclosed spaces, in crowded areas, indoors in particular, that face coverings will help to reduce transmission from person to person. Symptoms may develop, and we know that many viruses and other infections will be circulating. It's important that if people are unwell, that they should stay away from others as much as possible and get tested. It could be COVID, it could be the flu, but it's important that that discipline of not putting others at risk if you are symptomatic is something that we all practice as much as possible. If a test comes back as positive for COVID, it is important that people isolate, that they work with test and trace so that their contacts can be identified and the appropriate public health advice given. Those who have not had the app or who have disabled the app, now is a good time to re-engage with that, so that it can make that process of testing and tracing that much easier. If we do all of these things together, and I've said before that vaccination is a powerful tool, but it won't do the job all by itself. We need to also do all the other things around hand hygiene, face coverings, keeping our distance, reducing the size of social contacts outside the home, outside the people that we live with or work or associate with regularly, in order to reduce the risk of transmitting COVID from person to person. If we do all of this together, I think we can put ourselves in a good position to go into the winter and to continue to be safe, to create an environment where the NHS is not put under excess pressure, and we are able to come through the winter as successfully as I believe we have navigated the summer. Let's do all that we can to continue to keep ourselves, our families, and our communities safe, and to keep the pressure off of our health and social care system as much as we possibly can. Thank you so much.